Her doctor says Clinton has pneumonia and her upcoming trip to California is now in the air. That coming to us from a senior campaign advisor. Clinton this morning leaving a 9/11 remembrance ceremony in New York early this morning. Her doctor writing in a statement, quote, Secretary Clinton has been experiencing a cough related to allergies. On Friday, during a follow-up evaluation of her prolonged cough, she was diagnosed with pneumonia. She was put on antibiotics and advised to rest and modify her schedule. Well, at this morning's event, she became overheated and dehydrated. I have just examined her. She is now rehydrated and recovering nicely. After leaving that 9/11 ceremony this morning, she went to her daughter Chelsea's apartment in New York. Her team said she played with her grandchildren there, and you see her emerging from that apartment earlier today. She then headed up to her home in Chappaqua outside of New York City. Let me begin this hour with our chief medical correspondent, Dr. Sanjay Gupta. Sanjay, what we know at this hour, not a lot of details. We know from her team she overheated this morning, and we know from her doctor now saying that she was diagnosed with pneumonia on Friday. Interestingly, though, they didn't tell the public or the press about this pneumonia diagnosis. We've just found out about it now. What do you make of all of it?
Well, it's I think exactly as you said, we're still getting bits of information. It's coming in sporadically, trying to piece it together, and obviously all sort of simulated by this video of her getting into the van and having the difficulty getting into the van, seeming to stumble and having difficulty just even holding herself up with her balance. I think that, in medicine, common things are common. So the idea that someone is feeling out of sorts, unbalanced, is having the difficulty walking, getting into the van like we see in this video, could be explained by something as simple as dehydration. When you become profoundly dehydrated, you can drop your blood pressure, you don't feel well, it's harder to simply get around and have these sorts of problems. What is interesting, I think, Poppy, and you're alluding to, is at first we hear that she was overheated, and that sort of what caused these symptoms, and then just recently we hear that she has pneumonia, and it sounds like bacterial pneumonia, and that it was diagnosed 2 days ago. So either she's been powering through the schedule, just trying to make it work with pneumonia, or even against the advice of the doctor who said, you need to get rest, you need to be rehydrated. So we're hearing bits and pieces of information, but still trying to piece it all together, Poppy.